Hello everyone, this is Nurse Grace. Welcome back to the channel. In today's quiz, we will be practicing essential medical terminology to help you sharpen your skills and knowledge. Before we dive in, please don't forget to hit the subscribe button, like the video and share it with your friends to help grow this channel and support our community. Now, without further ado, let's get started.
1. A nurse is providing discharge teaching to a client with chronic bronchitis. Which instruction is most important for preventing exacerbations? A. Increase physical activity to improve lung function. B. Avoid crowds during flu season. C. Limit fluid intake to prevent mucus buildup. D. Use an air humidifier at all times. Correct answer, B. Avoid crowds during flu season. Rationale: clients with chronic bronchitis are prone to infections, and avoiding crowds during flu season reduces exposure to respiratory pathogens. 2. A client is admitted with an asthma exacerbation. The nurse notes that the client's wheezing has suddenly stopped. What is the nurse's priority action? A. Continue to monitor the client. B. Notify the healthcare provider immediately. C. Document the improvement. D. Administer a prescribed bronchodilator. Correct answer, B. Notify the healthcare provider immediately. Rationale: sudden cessation of wheezing may indicate a total airway obstruction, a life-threatening situation that requires immediate intervention. 3. The nurse is reviewing ABG results for a client with respiratory acidosis. Which finding is expected? A. pH 7.48, PaCO 232 mm of mercury. B. pH 7.30, PaCO 250 mm of mercury. C. pH 7.40, PaCO 245 mm of mercury. D. pH 7.35, PaCO 235 mm of mercury. Correct answer, B. pH 7.30, PaCO 250 mm of mercury. Rationale: respiratory acidosis is characterized by a low pH and an elevated PaCO 2 due to hypoventilation. 4. A client with tuberculosis, TB, is being discharged. Which instruction is essential for the client's understanding of disease management? A. You must continue taking your medications until you feel better. B. Always wear a mask when out in public. C. Avoid alcohol, as it can interfere with medication. D. Follow up with chest x-rays every 6 months. Correct answer, B. Always wear a mask when out in public. Rationale: to prevent transmission, TB clients should wear a mask in public until they are no longer contagious. 5. A client with a history of asthma arrives in the emergency department with confusion and lethargy. Which laboratory finding should the nurse assess first? A. Serum glucose. B. White blood cell count. C. ABG results. D. Potassium level. Correct answer, C. ABG results. Rationale: confusion and lethargy may indicate respiratory failure, and ABG results will provide information about oxygenation and acid-base status. 6. The nurse is teaching a client about the proper technique for using a metered-dose inhaler, MDI. Which action demonstrates correct technique? A. Inhale quickly and deeply while pressing the inhaler. B. Exhale fully before placing the inhaler in the mouth. C. Take 2 puffs in rapid succession. D. Hold breath for 1 second after inhaling medication. Correct answer, B. Exhale fully before placing the inhaler in the mouth. Rationale: exhaling fully before using an MDI ensures that the client can take a deep breath in to properly inhale the medication. 7. The nurse assesses a client with pneumonia who has a respiratory rate of 32 breaths/min, an oxygen saturation of 88% on room air, and crackles in both lungs. What is the nurse's priority action? A. Encourage the client to drink fluids. B. Apply oxygen therapy as prescribed. C. Notify the healthcare provider. D. Perform chest physiotherapy. Correct answer, B. Apply oxygen therapy as prescribed. Rationale: oxygen therapy is the priority to improve oxygen saturation and relieve respiratory distress in this client. 8. A client with cystic fibrosis is admitted for respiratory management. Which intervention is most effective in clearing thick respiratory secretions? A. Encourage increased fluid intake. B. Administer intravenous antibiotics. C. Provide chest physiotherapy. D. Suggest avoiding dairy products. Correct answer, C. Provide chest physiotherapy. Rationale: chest physiotherapy is effective in mobilizing thick mucus in clients with cystic fibrosis, aiding in airway clearance. 9. A client with a pulmonary embolism has an oxygen saturation of 90%. What action should the nurse take first? A. Administer anticoagulants as prescribed. B. Elevate the client's legs. C. Position the client in high Fowler's position. D. Increase oxygen to 100%. Correct answer, C. Position the client in high Fowler's position. Rationale: high Fowler's position facilitates lung expansion and improves oxygenation, a priority action before other interventions. 10. A nurse is assessing a client for early signs of hypoxia. Which symptom should the nurse recognize? A. Cyanosis. B. Hypotension. C. Restlessness. D. Decreased urinary output. Correct answer, C. Restlessness. Rationale: restlessness is an early sign of hypoxia, often appearing before more severe symptoms like cyanosis. 11. The nurse is caring for a client with acute respiratory distress syndrome, ARDS. Which of the following interventions is most effective in improving oxygenation? A. Encourage coughing and deep breathing. B. Increase the client's fluid intake. C. Place the client in a prone position. D. Administer bronchodilators as needed. Correct answer, C. Place the client in a prone position. Rationale: prone positioning improves oxygenation in ARDS clients by enhancing lung expansion and ventilation/perfusion matching. 12. A client with COPD is prescribed a low-flow oxygen device. Which device is most appropriate for this client? A. Non-rebreather mask. B. Nasal cannula. C. Venturi mask. D. Simple face mask. Correct answer, B. Nasal cannula. Rationale: a nasal cannula delivers low-flow oxygen, which is appropriate for clients with COPD to prevent oxygen-induced hypoventilation. 13. The nurse is teaching a client with obstructive sleep apnea, OSA, about lifestyle modifications. Which recommendation is most appropriate? A. Take short naps during the day. B. Use a soft pillow when sleeping. C. Sleep on your back for better airflow. D. Lose weight if overweight. Correct answer, D. Lose weight if overweight. Rationale: weight loss can reduce the severity of obstructive sleep apnea by decreasing pressure on the airway. 14. A client with pulmonary edema has an oxygen saturation of 86%. Which assessment finding is most concerning? A. Crackles hurt in the lungs. B. Elevated blood pressure. C. Pink, frothy sputum. D. Restlessness. Correct answer, C. Pink, frothy sputum. Rationale: pink, frothy sputum is a classic sign of pulmonary edema and requires immediate intervention due to fluid accumulation in the lungs. 15. A client is being evaluated for tuberculosis, TB. Which diagnostic test is the most conclusive? A. Chest X-ray. B. Tuberculin skin test, PPD. C. Sputum culture. D. Complete blood count, CBC. Correct answer, C. Sputum culture. Rationale: a sputum culture can directly identify the presence of Mycobacterium tuberculosis, making it the most definitive test for TB diagnosis. 16. A client has been diagnosed with pleural effusion. Which intervention will best help improve breathing? A. Place the client in a supine position. B. Prepare for thoracentesis. C. Encourage coughing exercises. D. Administer a diuretic. Correct answer, B. Prepare for thoracentesis. Rationale: thoracentesis removes excess fluid from the pleural space, relieving pressure on the lungs and improving breathing. 17. The nurse is monitoring a client receiving high doses of corticosteroids for asthma. Which potential side effect is most concerning? A. Weight gain. B. Hyperglycemia. C. Mood swings. D. Hypokalemia. Correct answer, B. Hyperglycemia. Rationale: corticosteroids can increase blood glucose levels, especially concerning in clients with diabetes or prolonged therapy. 18. A client with a pneumothorax has a chest tube in place. What is the most appropriate nursing action if continuous bubbling is observed in the water seal chamber? A. Clamp the chest tube immediately. B. Check for air leaks in the system. C. Increase the suction on the chest tube. D. Document as a normal finding. Correct answer, B. Check for air leaks in the system. Rationale: continuous bubbling in the water seal chamber suggests an air leak, which should be identified and addressed promptly. 19. A client with lung cancer is scheduled for a thoracentesis. Which position should the nurse assist the client into for the procedure? A. Supine with arms extended above the head. B. Side lying on the unaffected side. C. Upright, leaning forward over a table. D. Prone with arms at the sides. Correct answer, C. Upright, leaning forward over a table. Rationale: the upright position with the client leaning forward is ideal for a thoracentesis, allowing easier access to the pleural space. 20. A client presents with a productive cough, night sweats, and recent weight loss. The nurse suspects tuberculosis. Which precaution should the nurse implement? A. Standard precautions. B. Contact precautions. C. Droplet precautions. D. Airborne precautions. Correct answer, D. Airborne precautions. Rationale: tuberculosis is transmitted via airborne particles, so airborne precautions, including the use of an N95 mask, are necessary. 21. A client with pneumonia is receiving antibiotics. Which assessment finding suggests that the treatment is effective? A. Respiratory rate of 28 breaths/min. B. Blood pressure of 88/60 millimeter of mercury. C. Temperature of 98.6 degrees Fahrenheit 37 degrees Celsius. D. Productive cough with green sputum. Correct answer C. Temperature of 98.6 degrees Fahrenheit 37 degrees Celsius. Rationale: a normal temperature indicates that the infection may be resolving, suggesting effective treatment. 22. The nurse is assessing a client with bronchitis. Which finding is most consistent with this diagnosis? A. Bradypnea. B. Hemoptysis. C. Productive cough. D. Cyanosis. Correct answer C. Productive cough. Rationale: clients with bronchitis often have a productive cough as a result of inflammation and mucus in the airways. 23. A client with asthma has a peak flow reading in the red zone. What should the nurse advise the client to do? A. Take a long-acting bronchodilator. B. Use a quick relief inhaler immediately. C. Drink a glass of water and recheck. D. Increase daily physical activity. Correct answer, B. Use a quick relief inhaler immediately. Rationale: a peak flow reading in the red zone indicates an asthma emergency, and a quick relief inhaler should be used to prevent worsening symptoms. 24. A client with emphysema is experiencing difficulty clearing thick respiratory secretions. Which intervention is most appropriate? A. Encourage deep breathing exercises. B. Recommend bed rest to conserve energy. C. Limit fluid intake. D. Administer a diuretic. Correct answer A. Encourage deep breathing exercises. Rationale: deep breathing exercises can help to loosen and mobilize secretions in clients with emphysema. 25. The nurse is caring for a client with pneumonia who reports sharp, pleuritic chest pain. Which position should the nurse encourage? A. Supine with a pillow under the knees. B. Semi-Fowler's position. C. Side lying on the affected side. D. Prone position. Correct answer C. Side lying on the affected side. Rationale: lying on the affected side can help reduce pleuritic pain by limiting movement and reducing friction. 26. A nurse is caring for a client with COPD who is experiencing shortness of breath. Which position should the nurse encourage the client to use to promote lung expansion? A. Supine with arms at sides. B. High Fowler's position. C. Prone with arms extended. D. Sims position. Correct answer B. High Fowler's position. Rationale: high Fowler's position allows for better lung expansion by reducing pressure from the abdominal organs on the diaphragm, helping to ease breathing in clients with respiratory disorders like COPD. 27. A client with asthma is prescribed albuterol via inhaler. Which of the following side effects should the nurse educate the client to monitor for? A. Constipation. B. Bradycardia. C. Tachycardia. D. Hypertension. Correct answer C. Tachycardia. Rationale: albuterol, a bronchodilator, commonly causes side effects such as tachycardia, nervousness, and jitteriness as it stimulates the sympathetic nervous system to open the airways. 28. A client with pneumonia has a productive cough and is receiving oxygen therapy. Which nursing intervention is a priority to help mobilize secretions? A. Decreasing fluid intake. B. Placing the client in Trendelenburg position. C. Encouraging incentive spirometry. D. Encouraging a low-calorie diet. Correct answer C. Encouraging incentive spirometry. Rationale: incentive spirometry encourages deep breathing, which helps to open alveoli and mobilize secretions, making it easier for the client to cough up and clear mucus. 29. A nurse is assessing a client with emphysema. Which assessment finding is commonly associated with this condition? A. Cyanotic nail beds. B. Barrel-shaped chest. C. Clubbing of fingers. D. Crackles in lung fields. Correct answer B. Barrel-shaped chest. Rationale: in emphysema, air gets trapped in the lungs, leading to hyperinflation and a characteristic barrel-shaped chest due to the chronic overexpansion of the lungs. 30. The nurse is teaching a client about the use of a peak flow meter for asthma management. Which statement indicates that the client understands how to use the device correctly? A. I should use the peak flow meter after taking my bronchodilator. B. I will record my highest reading after 3 attempts. C. I should inhale as deeply as possible before using it. D. I need to hold my breath for 5 seconds after using it. Correct answer B. I will record my highest reading after 3 attempts. Rationale: the client should perform 3 attempts with the peak flow meter and record the highest reading to monitor their lung function and identify asthma exacerbations.
Thank you for joining me today for this medical terminology quiz. I hope you found it helpful and it boosted your knowledge. If you enjoyed the quiz, don't forget to give this video a thumbs up, share it with others, and subscribe for more quizzes and nursing content. I appreciate all your support as we continue to grow this community together. Until next time, stay curious and keep learning. This is Nurse Grace. Bye for now.